Hello everyone, welcome back to our channel. So in this video, I will be talking about the hypertension. So what exactly this hypertension is? So this hypertension, this is actually commonly known as high blood pressure. This is a chronic medical condition. So where the force of blood against the artery walls, this is consistently too high. And this is actually having no obvious symptoms, but it can lead to serious health issues such as heart disease, stroke, and kidney failure. Now we are going to see what causes this hypertension. So there are a lot of different factors that can lead to hypertension. So one is the lifestyle factors. Sometimes poor diet, the high salt intake, lack of physical activity, obesity, smoking, and excessive alcohol consumption, these can lead to hypertension. Now, genetic factors like family history of high blood pressure, this can also lead to hypertension. Then medical conditions. Some persons are diabetic, they have kidney diseases or hormonal disorders. So they actually increase the risk for this hypertension. Then this age actually blood vessels naturally stiffen as you age. So this can actually raise blood pressure. Then comes the stress. Chronic stress can also contribute to hypertension. Now there are two different types of hypertension. One is called as the primary hypertension and another is called as the secondary hypertension. So the most common form of the hypertension is actually this primary hypertension and it develops gradually over many years. Then comes the secondary hypertension. This is actually caused by an underlying condition like for example a person is having kidney problems or hormonal imbalances that can lead to the hypertension and these are called as the secondary hypertension. Then we have to see here how can we actually manage this hypertension or how we can cure this hypertension. So firstly we have to see the lifestyle changes in which we can actually modify our diet, we can do physical activities, we can actually do the weight loss, and if a person is smoking he has to quit the smoking, and then we have to manage the stress. So for this dietary modifications we have to follow actually the DASH diet, that is dietary approach to stop hypertension, in which we can take different fruits, vegetables, whole grains and lean proteins, and we have to reduce the salt intake like the sodium intake because this high sodium can increase blood pressure, and limiting alcohol consumption is important. So alcohol consumption actually leads to the hypertension. So some people take a lot of alcohol, so this is a very dangerous sign for this hypertension. So a person can get easily hypertension. Then physical activities like the regular aerobic exercises like running, walking, swimming, they actually help to lower blood pressure by keeping heart and blood vessels healthy. Then weight loss, losing even a small amount of weight is very important. That can significantly reduce the blood pressure. And smoking, this actually damages blood vessels and this raises the blood pressure. So you have to quit the smoking. Then stress management. Techniques like for example meditation or deep breathing, this can actually reduce the stress. And that reduced stress, this can actually lower blood pressure. Then medications. So you can take the diuretic medications, beta blockers, ACE inhibitors, or sometimes calcium channel blockers. So these are the different types of medications a person has to take during the hypertension. Then monitoring and regular checkups. These are important because regular blood pressure monitoring at home or during doctor's visit, this actually ensures that your treatment plan is working. And routine checkups can also help detect any secondary causes of hypertension. So this is important to see the routine checkups so you can detect if there is any secondary cause of hypertension or not. Then there are some natural remedies a person can take with the doctor's approval. Some are the herbal supplements like garlic, hibiscus tea, and flax seeds. They have been shown to help actually the lower blood pressure. But it is actually important to consult a doctor before taking any supplements. Then comes the magnesium and potassium rich foods. So both nutrients play a role in blood pressure regulation. So magnesium and potassium rich foods, they regulate the blood pressure. So we can say that this hypertension, this can often be controlled and managed with a combination of lifestyle changes and medication. And early detection and consistent management are key to preventing the severe complications that are associated with high blood pressure. So mainly lifestyle changes, these are very important in case of the hypertension. So if a person is really serious about in reducing his or her blood pressure, so he or she has to actually work on lifestyle changes. So this was all about this topic.